Hello everyone. My name is Dr. Aswini Prabhakar. I am the retina consultant working at Zamindar's Microsurgical Eye Center, Kalyan Nagar. So today I'll be talking about when is a detailed eye examination necessary. So now firstly, what is a detailed eye examination? When you enter an ophthalmologist's clinic, first you will be directed to the refractionist room where they will be checking your visual acuity for distance, near, and also give you a spectacle correction. And then you will be directed to the ophthalmologist chamber where the proper eye examination begins. Firstly, we do a detailed slit lamp microscopic examination of the anterior segment, which is the front portion of the eye, without any dilating drops. After the anterior segment examination, we do a proper intraocular pressure evaluation using various instruments like the Goldmann applanation tonometer, which we use regularly. This eye pressure checkup is mainly to diagnose and screen patients who have a tendency to develop a disease called glaucoma, which is a potentially silent yet blinding disease which can be irreversible if detected late. So we do an IOP, the eye pressure screening, for all people usually above 30 or 40 years. After the eye pressure evaluation, for a detailed complete evaluation of the eye, we also require you to be dilated. When I say dilated, it means that in the normal physiological state, the pupil of the eye is constricted and small, not allowing us to see what is behind it clearly except for a very small central portion. When we put dilating drops into the eye, the pupil dilates, allowing us to do a more detailed evaluation of the posterior segment or the retina, including the extreme peripheries, which becomes very important in certain conditions. Now, a detailed retina examination is advised in all people, usually after 40 years. And earlier if you have specific risk factors like diabetes mellitus, hypertension, or any familial blinding eye diseases including glaucoma, or any hereditary eye diseases which has caused visual loss in any family members. Also in very young children who are predisposed to a condition called retinopathy of prematurity, which is usually seen in children born prematurely and of low birth weight who have been given supplemental oxygen. So these are the conditions where a dilated retina examinations becomes mandatory. And as such, the eye examination would be incomplete without we actually see the complete retina as well for any abnormalities at all. In children and in young adults, it becomes important to evaluate a complete retina examination, especially when they are wearing a high power glass, which is called a myopia in technical terms. So what happens in myopia is there could be peripheral areas in the retina which are weak, which can be detected on only complete dilated retina examination, which may require you to sit in the waiting room for at least like half an hour to 1 hour for the dilating drops to take its effect, which is what permits us to do a detailed evaluation. So in conditions like diabetes mellitus and hypertension, a yearly retina examination is what we would generally recommend. Why is it so? If you wait for any visual disturbances to occur in a diabetic, it might be a little late in the course of disease to provide any treatment. Instead, if we do a dilated retina examination on a yearly basis, we could pick up signs of early disease which could be treated and avoid any vision-threatening complications of the disease.